years ago already in a special report that we've written.
Mm.
We know that the cost of cancer is, by the time 2030 hits, the cost of cancer is going to exceed 50 billion rand per annum. And I mean, that's an astronomical amount that nobody is really preparing for or calculating into their preparations. And we're saying, if we act now, if we come together, if we call it our call to action. If we act now and we are proactive, then maybe we can shift the space and we can make a difference together.
Absolutely. Now, the Cancer Alliance has been very vocal about the gaps within South Africa's health system regarding cancer care. What are some of the major gaps, and how do they
Mm.
then impact cancer patients?
Yeah, so it varies so widely, but basically it goes from, so just between the private and the public healthcare sector, I think we're all very much aware about the discrepancies in those two systems. But what we are particularly worried and concerned about is the gap between a patient presenting with a warning sign or a symptom that could potentially be cancer and the very tedious road they find themselves to get into the healthcare system and to get to a
Mm,
diagnosis, to get to the proper care. So that's gap number one. Once they are in the system, then there's multiple delays in terms of
mm,
laboratory results that's delayed, radiological investigations that's delayed, etc., etc. So by the time the patient actually gets to their treatment, there's already a massive delay. So we're facing tremendous strain on surgeries, patients waiting far too long for cancer surgeries, um, drugs that should be on the essential medicines list that is not available, especially in the public healthcare sector, and that certain medical aids have very strict restrictions on that we know can cure people, but simply not available. And we feel very strongly that these gaps can and should be bridged.
absolutely. The report does highlight that these gaps are costing lives. Can you then elaborate on some of the most pressing failures that patients are facing in the current system?
Yeah, I think front of mind at the moment is what's happening in Gauteng at the moment with the Gauteng Health Department, and we're actually involved in a court case at the moment where uh, cancer services have essentially collapsed at some of the biggest hospitals in Johannesburg, and people are waiting up to 3 years for radiation treatment.
Sure.
It's I, when you speak about cancer, that is simply unacceptable. It literally costs lives.
Mm,
People
mm.
die waiting for their care, and it should and it can be fixed. We firmly believe that. The same goes for life-saving surgeries, and the same goes for opening up access to
Yeah.
medicines that's available and that should be affordable for all patients.
Mhm. The 2021 Cost of Cancer report published by Cancer Alliance warns of a 50 billion per annum increase in cancer treatment.
Yes.
Those costs are estimated by 2030. So, what factors will then contribute to this alarming figure, and what can be done to prevent this cost surge?
So the interesting thing is it's that old saying of penny wise, pound foolish. So
Mm,
if we don't spend the money now on the right areas, we are going to pay dearly for it in the future. And the ways where we can spend money now is really focusing on improving our primary healthcare systems where patients can be diagnosed and identified earlier and get them faster to treatment because cancer treatment actually gets exponentially more expensive the more advanced and the more complex the
mm.
diagnosis gets. And then, of course, we all have to be wary of things that we can do in terms of our lifestyle that can prevent cancer and modifying those risk factors. So it's both about a cancer prevention strategy that can definitely save not only lives, but also money. And then also spending our money wisely now where it will matter the most in the future and save costs in the future.
Absolutely. And how do rising oncology medicine prices and uh, inaccessibility to care contribute to the growing crisis of cancer treatments?
No, it's massive and it's unacceptable. And I think this is where we as civil society, as, citizens, we need to keep both pharmaceutical companies, government that actually accept tenders from, companies, and the private sector that actually allows certain companies to price medicines. It's exorbitantly priced. And to try and find, and the people holding on to tenders where there's alternatives available that should be investigated, that should be allowed, that really can save lives. And it's a difficult conversation because these medicines do take a lot of resource to
Yeah.
develop. They are expensive to get to market, but I think once they are there, there should be a lot of pressure and there should be a lot of questions asked, in terms of getting these medicines as affordable as possible to be accessible to any patient, no
Yeah.
matter what your socioeconomic status.
Yeah. Yeah, absolutely. Now, the Cancer Alliance is advocating for the establishment of a National Cancer Institute. Can you walk us through maybe 5 key elements of this proposal?
Yes, absolutely. So, people always tend to say, like, we're in South Africa, National Cancer Institute, that belongs in the first world. It doesn't.
Yeah.
There's plenty of examples of, countries that's in the same situation, developing countries in the same situation as us, where these kinds of institutes have made a massive difference, not only in the writing of policies and the, determining policies around prevention, diagnosis, and care, but the execution thereof. Because a policy means nothing if it stands on paper. It only means something if it changes a life. So a National Cancer Institute would really be a brilliant opportunity to bring people together because it asks for a very integrated approach. You need the input of academics, you need the input of researchers, you need the input of the physicians on the ground, you also need the input of patients, of survivors, of people working with, the full journey of the cancer patient to really holistically contribute to this process, to bring people together under one umbrella. And out of that, policies can arise,
Yeah.
appropriate research questions for our situation, because we have, what's applicable in the United States is not necessarily applicable in our population or in our situation. So, coming up with appropriate questions, research questions, grants, etc., pushing that forward and
Yeah.
holding people accountable to execute on it. I think that's key for us, is the execution. Ideas are great, but we want to see action.
Absolutely. Now, the government and its involvement, when we look at that, the healthcare system review emphasizes the importance of cancer prevention as well as early detection, especially in the light of government's focus on primary healthcare under the NHI. So,
Yes.
how can early detection and prevention be strengthened within community level?
Absolutely. So we're very grateful that we are going to enter into a meeting with the National Department of Health in 2 weeks' time, where all of this is going to be discussed and fleshed out. But primary healthcare, that is where danger signs can be recognized and people can be identified early and referred appropriately. There's a lot of education that needs to happen there, and there's a lot of empowerment that needs to happen there, because people get stuck and, they can't move forward in the system. So it's opening up those referral pathways, educating the people working on the ground to recognize it. And then the other part of it is also within our communities, educate people about the risk factors and how simple modifications to your lifestyle can actually decrease your risk. That in the end will have a knock-on effect and make a big difference in the future.
I love it. In conclusion, in closing, what urgent actions must be taken to ensure that South Africa develops and implements a comprehensive national cancer plan?
It's a big question, but I think it's just it's continuing this wave of people coming together and adding their voice, like one voice calling everybody that's involved in a cancer patient's journey to action, to collaborate, to think together, to think outside of the box, and to really create care that is based in human rights and also just human to human empathy. I think that will go an enormous way. And if we can just keep telling the story and just say this is not right and we can fix it, we'll get somewhere.
Love that. Keep telling the story. It's important. And stakeholder involvement. I mean, what is the importance of that? And supporting the Cancer Alliance efforts in improving cancer for cancer care within South Africa.
Yeah, I think, everybody always say, oh, it's just me. I can't do anything. You have a voice.
Yeah.
You can speak. Tell, you've heard about this story that, cancer, or I know of somebody that's got cancer and she's been waiting for months for a
Yeah.
treatment. If there's a petition to sign it. If there is, quite frankly, a march, if activism is your thing, show up.
Yeah.
If you can donate something to either the Cancer Alliance or to one of our member organizations. There's 1,000 ways that even in the smallest way, all of us can make a difference.
Mm. We can all make a difference in ensuring that everyone at community level, as Liana has mentioned, does get the care that they need if they are cancer patients, whether they are adults or children. Liana Routz, thank you so much for joining us. We really appreciate you spending time in really, explaining and informing our listeners about the Cancer Alliance and, of course, the benefits thereof. We really have had an enriching conversation. Thank you so much and
It's
enjoy
my
your evening.
absolute pleasure, and thank you so much for helping us to tell the story. We really appreciate it.
Thank you very much and blessings to
Okay,
you. Bye
TC. You too.
bye.
Bye. Bye.
Bye. There you go, family. We can all make that difference, as Liana has already mentioned. Liana Routz from the Alliance, the Cancer Alliance, speaking to us about how the gaps in our healthcare system are affecting who gets the assistance. But here they are bringing a solution and saying maybe these are the solutions, these are the things that can make it better so that everyone has the ability to get health care or to get care should they be diagnosed with cancer. And together, indeed, we can, as she has already mentioned. We're going straight to a song now, Tasha Copes featuring Pastor Bertha Copes with One Place coming your way.
The Yellow Mic on Cape Pulpit.